I've seen family members, family caregivers get sick a lot. Their immune system is weak because of how stressed they are. People just get really overwhelmed and even just have like emotional kind of outbursts. It's the simplest thing that they have to do. From the outside, it looks so easy. It's okay, you just run to the store and pick up ice if your ice machine is broken, let's say. But to them, it's like it's the last straw, right? They can't get there. And it's because they're at capacity. Their emotional bandwidth is at their capacity.
Welcome to the Spotlight podcast, where we bring together experts, advocates, and professionals who serve seniors to educate, empower, and support families navigating the aging journey. Today's conversation is one of many that families face, yet not enough are talking about openly: the emotional and practical realities of caring for a loved one with dementia. I'm honored to be joined today by Alex Kaplan, lead caregiver at the Institute on Aging. Alex provides emotional support, dementia education, and resources to family on reducing caregiver stress, burnout, and isolation, something that is often overlooked as we focus the focus tends to remain solely on the person living with dementia. And today we'll be talking more about that caregiver experience, from managing the overwhelm and anticipatory grief to the importance of self-care, asking for help, and accessing resources like support groups and respite grants. This is a conversation for both families and professionals, because supporting the caregiver is just as important as supporting the individual with dementia. Alex, I'm so happy to have you today. Thank you for joining us.
Thank you for having me. I'm very much looking forward to this conversation.
Absolutely. Listen, we've had many discussions about dementia on the Spotlight podcast, but there's always a different kind of perspective and different experiences. So today's really, really exciting, and I've never interviewed somebody from Institute on Aging, so I would love to just start there. If you could tell me a bit about what is Institute on Aging, and define your role in the organization, and what type of families do you really support?
Yeah, of course. Good question. So Institute on Aging is a nonprofit organization located, the headquarters are in San Francisco, but our services run all throughout the state of California. We offer a lot of different social service programs that support older adults who want to stay at home, age in place. We help older adults who are at risk of homelessness. We help to reduce social isolation and loneliness through our 24/7 warm line called the Friendship Line. And we have home care, and we have a dementia service line called Compania. And I am part of the Compania program. I'm the lead caregiver coach, and I work with family caregivers who are navigating dementia, just like you mentioned. So I work with a lot of spouses, adult children, siblings, nephews, nieces, you name it. Anyone who is navigating and caring for a loved one who is living with dementia. It's a virtual program, so I can actually serve people outside of where I'm located, which is San Francisco. I mostly work with family caregivers that are caring for a person inside their home, but I also have some clients whose loved ones are in memory care. I have some long distance or remote caregivers, and I support them all the same. They all are feeling that emotional stress and overwhelm, and I am there to support them through education sessions, support group meetings, and our bi-weekly check-ins.
So I love that Institute on Aging focuses more on like the holistic approach of serving those with dementia and their caregivers. It's so important that we look at all aspects of dementia and the impact it has. The Friendship Line was something that I learned about a year ago from IOA, and I thought that was such a critical resource to be able to offer our community. I know you're based out of San Francisco, but are there other IOAs across the nation? And just for our audience, when I say IOA, that's the abbreviation, the short term for Institute on Aging.
Yeah, exactly. I know it's So our headquarters are in San Francisco, on Geary and Arguello. We have an adult day program called the Enrichment Center, which is located in the Presidio, so still within San Francisco, and that's where I get to work out of, which is amazing. I'm very grateful to work in such a beautiful setting. And then we provide services throughout the state of California, and we'll have satellite offices throughout. So I believe as north as Sacramento and as southern as San Bernardino County.
So it sounds like there's opportunity for other states to adopt something like IOA rather than just stay isolated in California. We have so much support. Our California residents are incredibly lucky and privileged to have the access to these resources. But if Institute on Aging could go across the nation, wow, could you imagine what that would look like for those with dementia? So one of the questions that I always wonder, just because I do work with people with dementia, the caregivers and the families, but I've never really been there to assess the initial impact on what it's like for emotionally, for a caregiver or even a loved one to have to handle the diagnoses of dementia. And I'm wondering if you've ever had experienced that initial impact with someone and what that looks like and how you really support them through that moment.
I've seen families experience a lot of different emotions when they initially receive a diagnosis. For some, it's almost expected because of the symptoms and signs that they've been seeing for a while, and they've been worried enough about these changes that they sought medical attention, went to a neurologist, got the testing done. So although the diagnosis is hard to hear and hard to see, it's not as shocking as maybe it would be for others. And in a way, it could provide them some sense of relief because now they know what's going on, and now they have a team behind them to support them and give them options. And once you have the diagnosis, then you can start really dialing into the support systems available. You could start planning ahead, looking towards the future and figuring out what care could look like and so forth. So a diagnosis can provide a family a sense of relief. On the other side of it, there's often a lot of sadness that we see, right? It's a really hard diagnosis to receive. And because it's terminal, I think, immediately there's this sense of overwhelm and sadness and a sense of loss, right? Because you know what's going to come.
Yeah, absolutely. I couldn't imagine if I was the one on the receiving end, getting that diagnosis for myself or a loved one. I mean, I think the first thing that comes to mind is fear, right? Fear of the unknown, fear of the sense of loss of oneself, of memories. And so that is definitely a huge challenge. I'm really excited about some of the new studies coming out and medicine that will help with dementia. Not a cure. Like we said, there is no cure. But I know I was talking to a cognitive neurologist from UC Davis, Dr. Chen, and she has been doing some recent practices that has really been helping with memory loss. And I can't even repeat what those practices are or strategies are, but I'm really excited that there are some things really on the verge of just helping people and evolving in the world of medicine. So that is something that is exciting, but nevertheless, that kind of diagnosis, it's scary. Like you said, there's a lot of fear. We said fear and confusion and just loss. So that is something that or the reason why it's so important that there's people like yourself here to support those that are dealing with dementia. Earlier, I had mentioned anticipatory grief. I would love if you can explain what is that and why is it so important for families to understand?
Yeah. I think we often think of grief when we think of end of life. And as someone, when someone passes away, you grieve them, but you can grieve a person before they are gone. They may physically still be there, but, there's a terminal illness diagnosis, that they are going to pass away. There's that impending death, and you can grieve before the person passes. And with dementia, we see that quite a bit, because although the person is physically there, they may not have the memories they may not have the memories they used to have. Their personality may have changed. If it's a partner, a spouse, you used to be able to go to them to brainstorm, to vent about the day, to plan vacations with, and now you can't. And that's loss. And although they are physically there across the table from you, they may not be really there, if that makes sense. And they're a different version of themselves, and you can grieve the version that you knew and loved. And while you still love the different version, it's still different, and they're not the same. So I see a lot of people grieving, and it's completely valid, right? And I think talking about it will hopefully normalize that. And sometimes just putting a name to it can help, because then you know what you're going through, and you can, Google and get online and find resources that can support you through your anticipatory grief. Because again, it is a valid emotion. And I don't think I think we often think of grief as something you feel when a person passes away. And that's not always the case.
Absolutely. I feel like, and I'm told this is just my own personal perspective, I feel like dementia or Alzheimer's it's one of those diseases that you really grieve the entire process, because there is loss after loss. It's not like a sudden death. It's like you were saying, it's not just about the passing or transitioning of someone. It's the entire journey that you're grieving. And also the loss of relationship. Your memories and your relationship, it's now forever altered. So it's such a like a heartfelt disease that really there's a ton of emotion involved in it, and there's emotion involved in all death, right? But it's just special, right? There's a special place for dementia. I want to kind of transition this a little bit away from the person with dementia to the caregiver, because I feel like, caregivers were thought of, this is their job, this is their duty, they get paid to handle this, but it doesn't take away the pain and the challenges that they face as a person. They build these relationships with the people that they're caring for, and it could be a loved one too. So there's definitely ties there. And there's a lot that they go through when taking care of someone that has a dementia diagnosis. Are there some of the hidden challenges that you can share with us that caregivers face when taking care of someone with dementia?
Yeah, so I, in the caregiver coaching program, mainly work with family caregivers, so spouses, adult children, and they are typically unpaid, although some are paid. But for the unpaid caregiver, for the family member, I think something that we don't always think about is just the emotional, I don't want to say burden, but it is like the emotional burden that they feel as they're caring for their spouse or their parent, let's say. I mean, they love them, right? They're going to help them in the shower. They're going to help them with their meals and everything that they need to support them in medication management. But it is so emotionally hard to see your parent or your spouse in that position, needing your support, being so dependent on you. And so that is one of the emotions that I think I see most and talk to families about, is just about how emotionally difficult it is for them, right? How sad it is for them to see them in that space.
100%. It's incredibly sad, incredibly emotional and draining, which oftentimes leads to burnout, right? I mean, there's burnout with nurses and doctors, and we heard a lot of burnout in the medical field when COVID came. Burnout is also with those caregivers and those family members that are taking care of a loved one. I'm curious, have you seen that with your, I would say, clients, for a lack of better words? Have you seen that? What do you do, or how do you prepare families when you start to recognize this in someone that you're working with just to walk them through that.
Yeah, yeah. Unfortunately, we have, and I think that's why this program is so great because we provide them the emotional support, we provide them the education and the tools they need to navigate this diagnosis.
Mhm.
And, they if you feel more equipped in the role and you feel a bit more confident in the role and you feel supported, it's less likely for you to fully burn out because you know who you can lean on and you have the resources and the tools to kind of navigate this difficult terrain. But I will definitely see burnout and just extreme levels of stress. I've seen family members, family caregivers get sick a lot, right? Because their immune system is weak because of how stressed they are. I've seen yeah, people just get really overwhelmed and even just have like emotional kind of outbursts, or it's the simplest thing that they have to do, and from the outside it looks so easy. It's okay, you just run to the store and pick up ice if your ice machine is broken, let's say. But to them, it's like it's the last straw, right? They can't get there. And it's because they're at capacity. Their emotional bandwidth is at their capacity, is at capacity. And I see this often. I mean, it's a huge role that family caregivers, you don't sign up for, right? You don't apply for this job and hope for it. It just lands in your lap and you have to figure out a way to navigate through it. And it takes a lot of energy. I mean, you're no longer just thinking for yourself, you're now thinking for a whole other person who's dependent on you. And so it makes complete sense why family caregivers feel so stressed and overwhelmed, and can get burnt out. Again, I see people getting sick from the stress. I've seen people have like stomach issues because of the stress. They're not sleeping well at night. They're isolating from their friends and their, social support system because they just don't have the energy to reach out or to go go and make plans with people. So there's lots of symptoms that come with burnout. But again, I mainly see like trouble sleeping, getting sick because their immune system is weaker, stomach issues, and social isolation. And
So,
also anger.
yeah,
Anger is part of it too.
absolutely. Something that I hear from the senior living aspect often is when a family goes from taking care of their loved one in their own home setting and they decide to move their loved one to memory care, or even possibly assisted living, depending on how far along the resident is along their journey with dementia. But the family comes up to us and says, I can actually step back and be the person that I was in this family member's life. Like I can actually have my dad back or my mom back, or I could be a daughter again, or I could be a son again, or a spouse. And you don't understand how impactful that is, just because it is hard. And like you said, we don't sign up for this, but we sure as well take it on if we are able to, if we're equipped to. And the truth is that none of us are really fully equipped to do this work, especially alone. And that's why it's so important to have resources like Institute on Aging and what you're doing with coaching people through this, because this is hard and it really does take a village, and a village of people who are knowledgeable and who have the tools and resources to be able to support them through this journey. Are there any practical ways that you can share with us that caregivers can use to take care of themselves when they're in a place of overwhelm or burnout?
Yeah, yeah. We always like to say it's a marathon, not a sprint.
Mm-hmm.
So you have to kind of pace yourself. And when we talk about self-care, although I would love self-care to be like a weekend retreat spa, like a spa retreat for the weekend, it often can't be. So even taking 5 to 10 minutes a day or a few times a day is going to help you get through the day. And the whole goal is to refill your cup. So however you can refill your cup, try to, right? And again, maybe it's not that big spa vacation, that retreat, but maybe it's a 10-minute conversation with a close friend. Maybe it's a walk around the block. Maybe it is a 30-minute massage, or, getting your nails and like a mani and pedi. Maybe it is going and like hitting some balls at a golf range. But it doesn't have to be big, right? It can be small. It can be turning on your favorite song and dancing in your room. It could be when you need to take a break from the situation, you walking into the restroom, you turning on the water and just splashing your face with it and taking a big deep breath, right? That can help you get past the moment, reset, and then re-enter the environment. So it really is all about just figuring out ways that you can refill your cup in small ways, because you can't pour from an empty one, right? So you have to make sure that you have enough energy, you have enough just enough energy to continue on throughout the day. But I wanted to mention how it can be really helpful to take out a piece of paper and a pen or a pencil and just write down who is in your support system, like who you can lean on if you need to. So think of friends, think of neighbors, think of doctors, think of different local organizations, if you have any connections to them. Like listing out those names can be really helpful. And then even listing out places or things you can do to kind of reset and practice self-care, and look at that list when you need to, when you feel like you're alone, and see how many names are there, and call one or text one of those people. Or if you're feeling like you just need to take a break, maybe on that list it says walk to the park, and then that's what you'll do. You'll walk to the park. So rather than having to make those decisions when you're in that moment of just like, maybe it's either crisis or just complete like depletion, you at least have that list you can go back to.
I love that. That reminds me of an exercise that is often done with people with depression. It's how can we get our mind off of what's happening and put it on something else that's more constructive and healthy for us. And although this is very different, it's still a valid tool to be able to have lists, have resources, have those support groups and things that we can do to refer to in those times where we know, okay, it's time for me to do self-care, or it's time where I'm feeling a little burnout and I need to really fill my cup again. Just to be able to go to one place and pull out some of the things that you need, some of the tools that you need. So that's really important, really good advice. I think you had mentioned caregiver support groups and how they can make a difference. Can you tell us a little bit about what that looks like? How do people access them? Do you know if they're just local in the Bay Area, or if there's some in other places across the nation or across California?
Yeah, I'm a big fan of support groups. I get to facilitate about 3 a month, and I love them, and I just find them to be very valuable for the people who attend. And I've seen how support groups can transform the person that attends them, or transforms the people that attend them. Support groups can either be in person or virtual. I think during COVID, everything was moved to virtual, and so there are still a lot of support groups that remain virtual. But if you prefer an in-person support group, they are most definitely out there. I recommend looking at Institute on Aging's website. We offer 2 in-person support group meetings in San Francisco at our Enrichment Center location. So that's twice a month that we have those. The Alzheimer's Association also has many, many, many support groups out there. They have virtual and in-person support group meetings. And the Alzheimer's Association is everywhere. So you can just go online and search the Alzheimer's Association, find your local chapter, and you'll be able to find support group meetings that are near you. I know the Family Caregiver Alliance also offers support group meetings. There are a lot of support group meetings out there. If you're doing a Google search, you may want to search Dementia Caregiver Support Group Meeting. I even know that there's some support groups that are for the individual living with the diagnosis in the early stages and their caregiver. The Alzheimer's Association has a really great one where it's for people who are in the early stages, so they attend alongside their family member. So those exist as well. They don't just have to be for the caregiver, but they can also be for the person with diagnosis. But I definitely encourage you to reach out and look. And if you can't access the internet, or if you just need someone else to support you in finding one, ask a friend. And a friend will do it, right? Their friends want to help and they just don't know how. And you giving them a task will allow them to be helpful. You can also lean on your doctor and ask them if they know of any local support group meetings, and they should lead you in the right direction. But
Absolutely.
I'm a big fan.
I'm going to throw one more in there. If you have a local assisted living community or memory care department in assisted living, you can go there and ask what support groups they have. Oftentimes they'll have professionals that they're connected with in the community, local community, and they may be doing something internally. They may be able to guide you and direct you into what's available in your local area. So that's also another resource. Now there's something
That's great to know.
yeah, something that I wanted to touch on was respite care. And I think we use this in different ways depending on who you are. But in terms of caregivers, if they don't fully understand what respite is, can you explain a little bit about that and why it's so important?
Yeah. Respite is a break. It's relief. It's typically temporary. It's temporary relief. So yeah, there are respite stays in senior living communities, and then you even stepping away and having maybe a caregiver come into the house and you having a few hours to yourself is considered respite, right? Again, it's temporary relief. And there are temporary respite grants out there. I think we were talking about that a little bit earlier, Athena.
Yeah.
And these are great, and not everyone knows about them. So please tap into this resource. So I know the Alzheimer's Association, Institute on Aging, Hilarity for Charity, Family Caregiver Alliance, they all have respite grants available. And a family caregiver can contact these organizations, and I'm sure so many other organizations out there, and they can call and say, I'm a family caregiver and I'm wondering if you have any respite grants available. And what that will do, you'll apply for the grant. And you'll either receive a certain amount of money or a certain amount of hours that you can use toward respite. And oftentimes you can use this amount for home care or for adult day programs. So we have a lot of individuals that come to our enrichment center in the Presidio that are on a respite grant, and they have X amount of days at the center for free so that the caregiver, the family member, can know that their loved one is having fun and is in a safe environment, and then they can take that respite for themselves. And maybe that is when you can go to the spa for the day or whatever it may be, right? Or do chores or see friends, whatever it may be. But those services, home care, adult day programs, they provide the caregiver the respite, the break.
That's fantastic. Are there certain parameters to qualify for respite that you're aware of?
It depends on the organization and it depends on the specific grant. Some will be income based and some will just be location based. So if you live in San Francisco and you're caring for a person, a loved one who also lives in San Francisco, you can qualify for A, B, and C grant, let's say. And these grants are out there. So if you don't live in California or in the Bay Area, I know I've been talking mainly about Bay Area resources or California resources, you can always reach out to your local area agency on aging or your senior services, your county senior services office, and ask them about respite grants as well.
Fantastic.
That's definitely worth it. And do a quick Google search as well.
Yeah. Again, it blows my mind how many resources there really are out there. People just need to know that there are resources and that you can access them through local community partners or just a simple Google search. So that's great to hear.
Yeah. And you're deserving, right? Like you deserve to get that respite grant and to get that break and to get that support. So that's why these grants exist. They are for you. They're for family caregivers.
Yeah, that's fantastic. again, I'm going to segue a little bit, going back and forth, going now back into the person with dementia, and I guess supposedly their caregiver or family members. Early detection, I think, is super important in so many health related diseases or issues, right? But why is it so important that families seek evaluation from a neurologist early on when maybe they have the inkling that maybe there's something going on dementia related?
Yeah. I think the sooner you can start planning. And now that there are, two FDA approved treatments, now that there is all this research showing that lifestyle interventions can help to reduce cognitive decline. Like now that there is all of this research and all these advancements, getting the diagnosis early is only going to help you, right? It's not going to hurt you. And it's so, yeah, I think the earlier you know, the better. I know it's scary. It's definitely scary to know, but if it's happening to you, it's happening. And this is how you can in some way like take control over the situation, and you could start making plans. I was talking to a neurologist a few weeks ago, and they were saying how great like a baseline cognitive test is and cognitive scan. So even if you aren't experiencing any cognitive changes, or they really just feel like age related, I still recommend seeing a neurologist and seeing if they can just take a baseline screening, just so that they can then track changes if there are changes. If you go into the neurologist and you've had symptoms for years and years and years, and they do all these scans and tests, obviously they can diagnose you, but they won't be able to see what the progression has been like because they don't have anything to look back at, if that makes sense. So no matter what, going into the neurologist early on will support you, whether you have the diagnosis or not.
Yeah, absolutely. I think it's just so important, right, to start setting up your support system, to ensuring that you're getting the best care early on. Again, we've already said, most people know that there is no cure, but there's definitely a ton of resources and things that we can do to slow the progression. So the quicker we can do that, the better we are off, giving us more longevity, or hopefully giving us more longevity and more time with our families, more time to figure out what's going on and how do we really move forward with this diagnosis. I think
Yeah,
that
completely.
absolutely.
Yeah, I was also just gonna add like the earlier that you get diagnosed too, you can start planning, and then you can really you have the ability to share your end of life wishes, what you want life to
Yes.
look like, what you want life to look like for you as the disease progresses, right? Like you have a voice, and especially in the early stages, right? Like so that's another piece, like why it's so important to get an early diagnosis and to start planning ahead of time, because then your spouse or your child doesn't have to guess for you, right?
Yeah.
Because you told them what you want. You've had those conversations. They're hard to have, but they're important to have.
Absolutely. And there are some things like, if you know that dementia is in your bloodline, right? I think we should be proactive and start writing down our estate plans, start putting down what our plans are, because once we're diagnosed, being able to do these things is limited. And so we want, our loved ones want to honor us and honor our wishes and really take care of us in the best way possible. So doing all of these things ahead of time, whether or not we ever reach a dementia diagnosis, it's just critical to our future and for our loved ones. So I think that's just really important to share as well. One last thing as we're kind of wrapping up, we've talked a lot about caregivers, our family and loved ones that are being caregivers and stepping into that role, about those with dementia and what that looks like and feels like. Are there things that the professionals, our local professionals who serve seniors, things that they can do to better support our caregivers in their day-to-day work that you can kind of share with us?
I would say checking in with them on a regular basis does a lot. I talk to my clients every other week, but very often if I know that they're having a hard time, I will check in between those sessions, and even just sending a quick message, like thinking of you or you're on my mind can be helpful. Taking away simple tasks from, like, taking it off their plate, can do a lot too. Like I have some clients who utilize paratransit, which is a great resource, and sometimes like just filling out the application or checking on your application status, it can just be too much, right? So you know, I do this, I'm sure other professionals do it too, like making that call for someone. It takes what, 10 minutes out of my day, and it doesn't add really much to me, and it takes so much off of their plate and helps them. So just kind of taking little things off of their plate as you can does a lot. And again, I think just checking in, if you learn about a new resource that you think would support them, let them know about it and help them access it. It's one thing to tell them about the resource, it's another thing to help them get through the door. So really just being there for them to lean on, and for them to have, listening ear and someone who can just guide them to these resources. It makes a big difference in their worlds.
Absolutely. And then lastly, if there is a professional who's working with a patient or a family, and there's a dementia diagnosis, and this professional knows that this family could benefit from coaching services like what you do, how could they make that referral or recommendation? Is there any way to verbalize that in a way that's meaningful, sensitive to the situation, and really going to help get them plugged in?
Yeah, I think, it's all about how you frame it, and it's not like, oh, you need help now, right? But it's more of, this is a really hard disease to navigate through, and this is a hard role, and let's get you some good support, right? Whether it be the emotional support that they're needing or the education that they're needing, the caregiver coaching program provides it all. And so I think, if anyone is working with a family who maybe just got the diagnosis or who has been navigating it for years and are struggling, share with them, right, that there's this resource out there, there's this program out there that can provide you the emotional support you're looking for, the dementia education that you're looking for. And what I love about it too is, in my education sessions, in my support group meetings, you're with other family caregivers. So you're dialed into a network of other family caregivers going through something very similar to you. Although, when you meet one person with dementia, you've just met one person with dementia, there are a lot of common themes and struggles that family caregivers experience. And so, getting to meet other people going through this helps you feel a bit less alone. And, you learn so many resources from them. You learn tips and tricks. You learn what not to do, what to do. So that's also a pretty magical piece to this program, which I don't think I had mentioned yet, but just the support that the other family caregivers provide each other, again, is pretty magical. It's the club that no one wants to be part of, but once you are part of it, you definitely feel that support. So, and if anyone, in the professional, like anyone in, senior services, if you have anyone that you feel like would benefit from this support, please reach out. You can contact Institute on Aging, and I know, Athena, you'll have the website and everything listed. So, yeah, but feel free to reach out to learn more about the services that we offer.
Absolutely. Well, Alex, I want to thank you so much for being here today, for sharing all the resources, tools, and practical steps to just taking care of yourself and your loved one when dealing with dementia. And we're just so grateful to have resources like you in our community.
Thank you. Thank you so much for having me. It's been really nice chatting with you.